Hello all. On behalf of York Hospital, welcome to today's Zoom webinar. Today, our panel of experts representing infectious diseases, pediatrics, and primary care will address community concerns about heading back to school during the current COVID-19 pandemic. Our presenters will share information with you for the first 45 minutes, then take questions at the end. A few quick housekeeping notes before we get started. Unlike traditional Zoom, when you see everybody's faces during the meeting, during this webinar, you will only see the presenters' faces. As participants, your audio has been muted. So if you do have a question, you can type it into the Q&A button located at the bottom of your screen. Please do not use the chat or raise hand features, as those will not be monitored during this call. If you ask a question through the Q&A feature and it is not answered during this meeting, you can email us at info@yorkhospital.com and we will get you an answer after the call concludes. This webinar is also being recorded and will be available on the York Hospital YouTube channel later this week. So now, once again, thank you very much for tuning in today. We will go ahead and get started and turn the program over to Dr. Evangeline Thibodeau.
So hopefully everyone can hear me. My name is Evangeline Thibodeau. I'm an infectious disease physician here at York Hospital. I'm an adult infectious disease physician, but I'm also the chairman of the infection control department, and therefore I've been closely involved in the response team in regards to COVID. So I'm going to introduce and give you an overview of what's been going on from the infection control standpoint and how that pertains to how you look at sending your children back to school. So this is a very busy slide. I want you to just focus on the bold features. This is a review of the literature, and what I can tell you up front is that the literature has come at us fast and furious. I give the analogy of it's like drinking out of a fire hose. It comes at us very quickly. It can sometimes go back and forth, but again, you look at all this literature and you make sound judgments based on how you're interpreting this. So this is early on in the pandemic. We're still just 6 months into it. We have a lot more to learn, but so far there's a lot of good news that pertains to children. The first is that children are less likely to get infected. So there's been some data out there that although children make up 22% of the US population under the age of 18, they've only accounted for about 2% of COVID-19 diagnoses. Children under the age of 20 so that they're estimated to be about half as likely to get infected with COVID-19 compared to adults, over the age of 18 to 20. Children also are less likely to have a severe disease course. I'm not going to go into some of the clinical outcomes that my pediatrician colleagues are going to discuss, but there has been a lot of data supporting that children, especially under the age of 10, and excluding the infants, have a less severe disease course than adults and some of the older children. So that gives you an idea of the comfort level that the children are not behaving like the elderly patients that we see, or the patients with a lot of medical problems or underlying medical conditions. So that's some good news. The third bullet point there on the left is that children are less likely to spread the infection. So from the health standpoint, how likely are they to propagate this pandemic? And there was 2 studies out that really kind of confirmed that they are less likely. There was one in Switzerland and one in South Korea you may have heard about, and really the children under the age of 10 have been shown to be less efficient transmitters of the disease. So that means if they get exposed somewhere, they're less likely to be the one that brings it back to their family and infects, mom, dad, and grandma. So from the public health standpoint, that's some good news that especially the little ones are under the age of 10 are less likely to be responsible for advancing the pandemic. But I always say proceed with caution. So again, this literature is early on, so we want to just keep an open mind as we go through this pandemic. Children are more likely to be asymptomatic, and we know that about 40 to 45% of cases are actually asymptomatic. So if children are more likely to be asymptomatic and they can still spread the disease, we just have to be cautious. Children also have similar outcomes to influenza. They actually looked at some data from the last seasonal influenza year. This is very recent data that came out about the last 1 to 2 weeks that shows that children have similar hospitalization rates, similar needs to be in the ICU as when they're infected with COVID-19 compared to when they're infected with influenza. So that's promising because we think that children are, that influenza does also infect adults and patients with comorbidities more so, but they're certainly not immune to it. So we do still need to proceed with caution in terms of children and thinking about how they could get sick from this. School closures, there's been a lot of data and a lot of modeling studies. So trying to do computer simulations on how effects of school closures actually mitigated the spread last spring. And there was shown to be some benefit. To what degree, we don't really know, because again, these were modeling studies and they were done at the same time that we did multiple other drastic measures such as stay-at-home orders and shutting down businesses and all starting to wear masks. So to how much of the school closure impacts the pandemic, it's hard to say. But there's some data promising that it wasn't as much of an impact as some of the other community measures that we implemented. The last bullet point there about viral replication, this is just to proceed with caution. There's some data out there that children under the age of 5 actually had higher levels of viral replication. What does that mean? I'm not sure yet. We still think that children, younger children especially, are less likely to get sick and less likely to propagate the spread. So that's kind of a smorgasbord of some of the data that we've been looking at over the past 6 months. And to give you a brief overview, if you want all of these slides I have all the primary literature in here. If you'd like access to that, you can certainly email us to get access to that. Okay, I'm just going to briefly go over the Maine Department of Education has put out 6 requirements for safely opening schools. This is fairly consistent with what other states and actually most practices are following in terms of doing some kind of symptom screening, just a mental check-in every day if folks are feeling, making sure they're not having any symptoms, keeping distancing, 6 feet optimal, sometimes 3 feet if 6 feet can't be accommodated. I just want to spend a little bit of time on the masks and face coverings. The mask is used as a source control. So we wear masks to decrease the risk of the wearer spreading it to other individuals. And there is overwhelming data that the masks are really helpful in terms of controlling that source. There's also some data that the mask may protect you. I'm talking about cloth face coverings as opposed to in the hospital setting surgical masks. There is some data that the cloth face coverings can actually protect you from getting infected as well. So, but the main reason we wear it really is a source control. So face shields have become discussed, and we just don't know how well that face shield acts as a source control. We don't think it works that well. So as at York Hospital, we strongly encourage everyone to mask wear as much as possible. And if the face coverings want to be used, they should be used in addition to masking. So the other 3 there is the hand hygiene, the personal protective equipment especially for nurses and folks who may be caring for ill children. And then the schools really should have a clear guideline in terms of what to do if a child has COVID or another infection and when it's safe for them to return to school. Just want to go through the local data because this is what I really look at when I'm making decisions at the hospital level as well as personal decisions. I look at the positivity rate. So this is the number of positive tests divided by the total number of people tested. In Maine, we are doing excellent. Our overall last 7-day positivity rate as of earlier this week was about 0.5%. I'm not going to go into York County quite yet. I will address that in the next slide. But overall, as a state, we are doing excellent in terms of our positivity rates, and we've been less than 1% for a few months now. New Hampshire, they're doing quite well as well, and when I last checked earlier this week, their positivity rate was about 1.8% as a state. Nationally, we're in the 5 to 6% rate. That is coming down over the past month or so, but overall, Maine, New Hampshire, New England in general is doing very well with our positivity rates. You also want to look at your testing capacity. So how many number of people are getting tested per population? And again, Maine is actually doing quite well compared to the national levels. You want to look at your local turnaround time. So where your children may be tested, what's the turnaround time? If you have an ill child or family member that you want tested, how quickly can you get that result? Because when you get tested, you're quarantining until you have the result of that test. So this is the data you really want to look at when you try to make some decisions in terms of how you behave and in terms of sending your children to school. So like I said, the factors to consider is looking at that data, the local positivity rate. Is it increasing? Is it decreasing? So just a word on York County, because I'm sure we'll get questions on this. Yes, York County has become a, quote, hotspot in Maine because of the rising cases and the increasing number of outbreaks in our county. And last week, our county was changed from the green designation to yellow in terms of proceeding with caution about sending your children back to school. So that's just something to watch. Overall, our York County positivity rate, I think on my previous slide here, I said 1.8%. As of yesterday, I think it was closer to 2.1%. So that number is still going up over the past couple of weeks. You want to watch that and see what is your state doing? What are the surrounding communities doing to help decrease that number? What is your district doing? So are they following the 6 requirements from the Maine DOE? Are they looking at this? Federal CDC has also provided guidelines. Is your school doing that? Are they following these guidelines? And then on an individual basis, are your children at higher risk of severe disease, or is there family around them that may be at risk of higher risk of severe disease? So those are the kind of questions you might want to ask yourself, in the sense that what's your level of comfort? And again, your level of comfort may be very different from your neighbor's level of comfort. Everyone's going to have different kind of judgment calls and levels of comfort in these situations. The last point is, what other activities are you doing and how do you prioritize them? So the more people you're in contact with, the more environments you're in, just the more chance that you may be at risk of being exposed, and not only getting sick, but needing to quarantine and kind of stop and stay home for 14 days if you are exposed. So you just think about not just sending your kids back to school, but what other kinds of things are you doing as well? So these are just all the factors. And again, it's going to be a personalized decision that you're going to make when you look at all these factors, but I'm hopeful that I've provided some data that helps you come to your decision. Looking forward, because I think this may address some of the questions, this is my last slide before I move on to the pediatricians, is the vaccine. I figured we'd get some questions about the vaccine, and I'm not going to go into any details about any vaccine, but there are over 100 COVID-19 vaccine candidates. The pediatricians are going to focus on the importance of staying up to date on your routine vaccinations, especially annual influenza. On an individual basis, you want to protect yourself from getting influenza, because you would not want to get sick, but also in terms of confounding the issue, if you were to get influenza and COVID at the same time, that could actually be possible. So you really want to do anything you can to prevent yourself from getting sick. The FDA has promised at least a 50% effective vaccine before putting into production, so I have some faith in that. And there's been some pharmaceutical companies that have also promised that they want the vaccine to go through all the vigorous data before putting it out. And I've spoken about this before, that really all of this vaccine data has, the timeline has gone from 6 months scrunched down, almost 6 years, almost scrunched down to 6 months. And really safety is of the utmost importance, that they're really not compromising safety when they're doing these vaccine trials. Once we get vaccinated, what's next? We're going to be continuing our physical distancing measures until we reach a comfort level that we have enough immunity in our population to be to not have to return to normal, as we say. It's not going to be a light switch, abrupt return to more normalcy. We're going to have a gradual return with gradual relaxing of our safety precautions. My last point here is about mask use, and just overly emphasizing the use of masks, especially when you can't maintain that 6 feet from anybody inside or out who's not in your household. And this MMWR was published out from the Midwest, and this was one that really just stuck with me out of all the data that I'm reviewing. This study really, it was just one of those ones that resonated with me in the sense that masks really do work. They looked at over 139 customers in a hair salon that were exposed to 2 stylists who tested positive, and almost all of the stylists were wearing masks the whole time, and almost all of the customers were wearing masks, and not one of those customers came down with COVID-19. However, the household contacts, so when the stylists went home, took off their masks, they infected 4 of their household contacts. And if you think about hairstyling, that's pretty close. So masks are really what's going to help us get through this. So I will leave it at that, and I'll turn it over to our pediatricians.
Hi, my name is Dr. Jones. I'm one of the new pediatricians down at the York location. You'll be briefly hearing from the 3 of us about various mental and physical health considerations facing our kids these days as we progress through the pandemic. I'm going to try to share my screen here. And it looks like it went through. So I'll be speaking about something called multi-system inflammatory syndrome in children. A lot of parents may have heard of this on the news. It's one of the more serious, more feared complications of COVID infections in children. As was mentioned before, for the vast majority of infections in kids seem to be a very relatively minor self-limited viral infection. However, in a limited number of children, there's a more complex, more serious secondary illness that happens shortly after the initial viral infection. So I'm just going to speak a bit about that today. I'll just briefly go over the definition of the illness itself, some of the characteristics of the disease that we as pediatricians use to recognize it, and then some of the clinical features and considerations in their treatment. Most of my information came from 2 studies here performed in the U.S. across multiple states. This data was published this past July, and then there was another study in New York State where the data was gathered earlier on in the pandemic once it hit New York. And I draw a lot of information from the American Academy of Pediatrics guidance as well. So the definition of this disease is basically a child who has evidence of a COVID infection shortly after having a prolonged fever greater than 24 hours with laboratory evidence of inflammation and signs of organ dysfunction. So these are generally very sick kids who have been febrile for several days. They have vital sign instability, so elevated heart rates and changes in blood pressure. They can experience signs of organ dysfunction, difficulty breathing, severe stomach pain. And they universally show evidence of high inflammatory response on lab studies. All of these kids also have a recent exposure to someone with COVID or a confirmed COVID diagnosis. So this study looked at 186 kids in 26 states. That may sound like a large number, but given the rates of infection, it's actually not very many kids that seem to get this disease. The ones that do, the majority of them were previously healthy. Interestingly, a higher percentage were male. 80% of the children were sick enough to end up in the ICU. 20% required invasive ventilation. About half of them required vasoactives, or basically medications to help support their blood pressure. The outcomes of this disease are not fully understood. There's still a lot of information looking at kids who have this and how they do long term. but the majority of the children did survive the illness. Only 4 deaths out of the 186 were reported. That's a death rate of 2%. So this graph just quickly shows that the increase in MIS-C cases corresponds to about a 3-week lag from a peak in COVID cases seen during this study. So it seems like children will get sick with COVID and then several weeks later develop this complication. This is some demographic data. These cases were kind of clustered in areas where there were a peak incidence of COVID early on. The age that seems to be most acutely affected by this complication is sort of in the middle school age children. So kids who are between 1 and 4 and 5 and 9 and 10 to 14 experienced higher rates here, with a median age being 8.9 years. So I think this illness seems really scary. As a parent, having a kid and making a lot of decisions about his health, something that has been really reassuring for me is that kids who seem to get COVID-19 generally do very well. This particular complication is definitely was initially cause for alarm, but the information we've learned shows that it's actually a very rare complication. There was a study early on in New York that showed the incidence of COVID in children, anyone younger than 21, was actually 332 per 100,000 people, which is pretty rare in and of itself. And then of that population, 2 per 1,000 kids experienced MIS-C. So basically the gist of the data as we understand it at this point shows that this complication, while it is serious, is very rare, and it's not something we're seeing a lot of. It's very recognizable. We as pediatricians are equipped to pick up on the early signs of the disease and get these kids where they need to go for further treatment as soon as possible. And it is a treatable disease. We're learning every day how to better manage and support these kids through this complex illness. We're learning more about some of the longer term complications of this particular disease. And I feel as a pediatrician equipped to recognize it and get the kids the effective treatment they need. This is my son here. He's 14 months now, and this is just a way my wife and I were killing time during quarantine. I'm happy to answer any questions at the end of the session, and I'll turn it over to, I believe, Dr. Vinograd next. Oh, sorry, Harriet next.
My name is Harriet, and I'm a pediatric nurse practitioner here at the Pediatric Primary Care. I have a minute to share with you some of the emotional impact that I have seen as a result of caring for the families over the past few months. Then definitely everyone was a loss of routine, and from that loss of routine, going to school every day, loss of community. The community is really important to providing stabilization and structure to the day of a family, not only just the children. And our teachers comment frequently on how much they're missing. Basically, the loss of community, I think, is a really important point here when schools closed. Children began telling me about being bored. Staying home was certainly a source of that. There is definitely not as much stimulation that you get when you're in a classroom. And the other interesting thing that they would say is that the teachers weren't making me do what I needed to do. So that was an important point for keeping them on task, and they were not feeling that same way at home most of the time. Many were frustrated from the well, the basically because we have partners. Definitely all ages are it is nobody had experience I don't know what was going to happen and day to day, and so that's obviously unnerving for everybody who's involved. As engineers go to just you certainly have come a long way in the last few months. And the other as well enjoyed and they felt great loss. And so it wasn't quite as stimulating for them. And then for our children who required additional expert support at school from professionals like occupational therapists, and then parents, I can tell you, are very, very appreciative of teachers at this point because their ability to turn around and become a teacher wasn't easy. I mentioned some of the challenges that people had around remote learning and just the computer and internet issues. A huge area for problems was distractions. I can't tell you how many families told me about the cat and how distracting the cat was, or the new puppy because everybody got one during COVID. It was very easy for kids to engage in things other than learning, and that would put them in a disadvantage because they would not do their lessons, or they would not do them until very late at night, and it was less optimal. Almost everybody mentioned how difficult it was to communicate between teachers, students, and parents, and that again is part of the computer sort of internet issue, and again not knowing really how to do this, but they really count on that conversation for days to stay stabilized. And like it really helps them to stay focused. And I had a dad who was a teacher who said to me that he never realized how much those short and sweet conversations that occurred throughout every day were so incredibly important in terms of just understanding where the student was, what they needed, and just creating the space for questions to be asked. Parent responsibilities with remote learning. For the parents that are online, I know you all know how challenging this was. You are, many of you also managing your own jobs from home, and that was very difficult. Childcare challenges when schools closed. Who's going to be at home helping my child? There were children that were staying at home who maybe were a little younger than they should be to be alone. Big issue around control of students saying, I'll do my work when I want to do my work, which was for many of them a positive, but in the end didn't allow them to do it in time. And they get some very unhealthy habits, and very large that had to do with sleep habits. They were very regulated, especially teenagers, going to bed and sleep much. So it's difficult for us to keep that habit to make sure they are more limited to distribute but the problem with with the bedroom is that it should be a space for sleep. So losing that distinction actually contributed to a lot of the sleep problems that kids were having. I already mentioned that the children with developmental needs and special education had less supports. And the other interesting thing is that many of our children received mental health care through their school systems. And those resources dried up, and making a switch to a therapist in the community was not an easy thing to do. And so many kids went without support and are still without support. So some suggestions from what I've observed. Creating a daily schedule, writing it down, posting it, so important to keep some normalization to the day. Setting a time to get up every day, a specific time. This will sound silly, but eat your breakfast, dress for the day, brush your teeth, comb your hair. Kids were getting into really bad habits and not doing that, not preparing, not taking the schoolwork seriously. I know that a lot of schools are switching to more of a Zoom platform where there will be a structured day, and I think that will help a lot. Designate a learning space, not their bed. Plan for breaks, exercise breaks, commit to meals. Eating habits were all over the place, especially given the changes to their sleep habits. Outdoors, being outdoors, exercise, very important, and that was happening a lot, actually. We had a great spring and summer. Find substitutes for sports, find substitutes for the other special activities that kids liked. Create your social bubbles, as has been mentioned along the way. Keep them small and secure with people you trust. Dial back the media and have a family media plan. As soon as I start to talk to kids about controlling their use of electronics, they say, but mom and dad, you blah, blah, blah. So it needs to be a family commitment. Family stress. So all this is going on is creating family stress. And the point of this is that families are systems, and each person has an effect on the other person in the family. It's a reciprocal interaction. And so once one person is feeling this, there is a mutual effect on everybody. And so that just makes things much more tense. Strong emotions are very exhausting. And so a lot of complaints about fatigue. So when you drain your energy, you just get stuck in a rut, and it's much harder to reorganize yourself and move forward. Emotions can be very uncomfortable and very unpredictable and very reactive, and that happens for kids and parents. So, sort of watching carefully what's happening in your home is really important. Anger is loud, boredom is quiet, and everything can surface quickly and unpredictably. And the more stressed a family member becomes, the more likely they are to become depressed. So these things can creep up on you. Your thinking mind doesn't rule what you do, your emotional mind does. So keeping in tabs with what you're feeling is really important. Having children express what they feel to you and trying to get that conversation going on a regular basis is really important. Kids are sponges. They soak up everything. Even infants do. So they know what families, adults in the families are going through, and they pick up on it, and it influences them. They need to feel safe at home, and when they feel a lot of tension in the home, that affects how they are feeling in terms of how comfortable they are. And this is really important. Not all children or families react the same way. We've had families fly through this and do wonderfully. There are some wonderful things that came out of taking time away to be a family. So just keep that in mind, that not all families are suffering, but many are. A family going into this who is already vulnerable has a much higher risk for these kinds of things happening. Need to be on the lookout for it. Parents who are stressed become less responsive, more authoritarian in their parenting styles, and more distracted. And that's just a coping mechanism, not to lay blame. So a couple things about parents. Be careful to support yourself. Be patient with yourself. You are doing an amazing job, not one that has been charted for you before. Pat yourself on the back and just appreciate what you are accomplishing. When your emotional energy is low, your resilience is low, and that includes being more susceptible to becoming ill. So taking care of yourself is critically important. You might not control what's happening around you, but you can learn to find what in that situation you can take control of. Create your own daily schedule so that you have your needs met as well. Again, many of you are working from home, and doing that with trying to homeschool kids is not an easy thing. Family huddles, communication. Start every day with, this is what we're going to do. These are our challenges today. Who's going to do this? Who's going to do what? We are a family and we are a system, and we're going to get through it together. Self-care, I've just been talking to you about. It's not optional. Parents, you need to do this for yourself. You need to carve out a few minutes of the day to take care of your own health and well-being. When you need help, ask for help. Primary care is a place that everybody can begin to get some help. We do this for families and their children all the time. I'm sure that all the primary care providers out there do the same thing. Remember that taking the first step is what's really important. And I know we're running out of time, so I don't want to take up too much more time, but please, whatever questions you might have, I'm happy to try to answer at the end of this. And I think it's Dr. Vinograd's turn.
Good afternoon. I hope everybody can hear me. My name is Dr. Vinograd. I know we're running out of time, so brief introduction. I'm working here as the chief of pediatrics. I'm originally from Brooklyn, New York, but I've been living in Maine for the past 5 years. I have been working for the past 2 months with an amazing pediatric team here at York Hospital, 2 of the members who you've just met. The purpose of my talk today is to bring attention to vaccine preventable diseases. The concern is that in the midst of this pandemic, we're going to see an increase in vaccine preventable diseases in healthy children, but also in the most susceptible populations that are not vaccinated and not able to get their vaccines. So just as proud as I am of being part of the York Hospital pediatric team, I have another team that I'm very proud of as well, and this is my family. My daughter is 5 years old. Her name is Evie. She's about to start Village Elementary, and I share for all the parents out there who are about to send their kid to school for the first time. I share in the same trepidation and the same excitement and the same, we're in the same situation. And I know it's a cliche to say that we're all in this together, but the reality is that we are all in this together, and we're going to make it through together as well. My son gets credit here because he is 10 months old and he's in what I call the eye of the vaccine storm. So he is in the midst of getting his immunizations, and so he is looking very cute there, smiling. The title of this slide says a lot to me. We vaccinate to protect ourselves, but we're also doing it to protect others. There are children and adults, for that matter, in our community and across the country that cannot get their vaccines. They either have contraindications to getting immunizations, they are immunocompromised, they're born, congenital immunodeficiencies, pregnant patients that are undergoing immunotherapies, such as IVIG, chronic steroid use, patients that have anaphylaxis to certain components of vaccinations like gelatin, neomycin, anaphylaxis to latex, patients undergoing blood transfusions. The point I'm trying to make is that there is a subset of the population that cannot get these vaccines and are susceptible to these life-threatening illnesses that we can protect them from by herd immunity. So this is a very daunting slide for all the parents out there. At the sake of time, I'm not going to take us through all of the different immunizations, but this is the CDC recommendations for vaccinations. Now, out of all of the vaccines that I just showed you on the CDC list, I want to zoom in and focus on one virus in particular, and there's a reason why I'm going to talk about this virus. measles is the most contagious out of the vaccine preventable diseases. It presents with a high fever and the 3 C's is what we call it: cough, coryza, which is thick purulent nasal discharge, and conjunctivitis. Koplik spots are white spots that are on the inner buccal mucosa. This virus is spread not just by mucus secretions, but it's aerosolized. So this is an airborne virus. So R0 is an interesting measure, and it's used to, and the basic way to think about it is it shows you how fast a virus can spread. It represents the average number of people that are infected by one infectious individual. In other words, if we look at measles, for example, one person with measles can transmit the virus to 12 others, compared to COVID-19, where this R0 is 2 to 3. So, based on this, we can get a better understanding as to why this virus is so contagious and why I'm talking about it today. The attack rate is another measurement, and the attack rate in a household is the likelihood of other susceptible members in the household to get sick from this virus in the event that a child were to bring it home or a patient were to bring it home. And measles has a 90%, up to a 90% attack rate in some of the studies that I read. Even though COVID-19 studies are still ongoing, the rate is about 49.5% attack rate. Complications would be, could be life-threatening for measles. It includes pneumonia. It includes hospitalization, 1 in 4 patients, encephalitis, and long-term neurologic disease. Especially the neurologic disease is especially common in kids less than 2 years old. I neglected to mention the rash that you're seeing in the picture, and you can see that the measles rash is a head-to-toe rash, meaning that's how it spreads from the top of the head down to the toes, and it's not an innocent rash. Koplik spots are what we're seeing over here. It looks like salt granules almost inside the buccal mucosa. The brief history, again, out of respect for time, I'm going to be as fast as I can. Brief history about measles is that the vaccine was created in 1963. And if we look at where we've come from 500,000 cases a year to eliminating measles in 2000, that is extremely impressive. This is also attributed to a second dose recommendation by the CDC in 1989 for school-age children 4 to 6. Despite this, we're seeing sporadic outbreaks throughout the country, and more so in recent years. After, we're always talking about COVID. I haven't heard many people talking about the 2019 measles outbreak that we saw. And, in 2017, we had 75 cases that occurred in Minnesota and the Somali American population within a month, with 31 cases requiring hospitalization. 2018, there was an outbreak. There were 17 outbreaks in New York and New Jersey. Measles cases in 2019, this is what I really wanted to focus on. Just last year, 1,282 individual cases of measles were confirmed in 31 states. Of these, 128 were hospitalized and 61 reported having complications, including pneumonia and encephalitis. That's the greatest number of cases that we've seen since 1992. So very briefly, I'm also a huge advocate for the influenza vaccine. We started at 6 months of age, where we can give the first flu vaccine. We give 2 doses the first flu season that you receive this vaccine. It helps to boost up the antibodies, and every year from then on, it's just a reminder as to increase the immune response. To emphasize the need for influenza, I know Dr. Thibodeau talked about it briefly earlier. In 2019, we had 188 influenza associated pediatric deaths that were reported to the CDC. The goal is not just to prevent the flu complications and keep our kids healthy. There's also another aspect, which is to reduce the impact of these respiratory illnesses, not so that we don't overwhelm our healthcare system, especially during this COVID pandemic. Again, very briefly, I'm going to go through this. This is more of a local look rather than a generalized discussion, but As of December 31st, 2019, Maine ranked 9th nationally when it came to compliance with the CDC vaccinations. And York County in particular is ranked 11th out of 16 counties when it comes to compliance to the CDC recommendations. I'm going to zoom in here on the the MMR vaccine compliance. We're at 87% in York County compared to 88% in the state, and a goal of 90% to ensure herd immunity. The flu vaccine, we're 65.4% compliant. 65% is the main average, and the goal being 70%. So again, you know, Dr. Thibodeau mentioned it, hand hygiene, keeping our kids, really promoting the efforts that the schools are taking to ensure that we're reducing the spread of viruses and bacteria. Please follow up with your primary care doctors, keep up to date on your immunizations, and individualize your back to school plans with your primary care physicians. Some excellent resources I have here, and I thank you for your time and for joining our conversation. I'm going to hand over the presentation to Dr. Todd Adams. We look forward to answering some questions.
All right, I think I've got it there. Thank you, everyone, for taking a little bit of your afternoon to spend time with us today. I know we're running toward the end of the hour, so I will certainly try and keep it brief. The focus of my talk was really caring for our community and steps to keep you safe in unprecedented time. Really, I serve as leader for the physician practices. I've been practicing internist. I've been at York Hospital for 19 years now, and have seen certainly many challenges in this community over that period of time. But this is something we certainly haven't encountered before. Preparation began earlier this year with lots of uncertainty. There was a great group effort from the leadership, from frontline workers, input from materials management, because as you all know, some of our supplies were limited. Guidance guided us with from CDC as well as our infectious disease providers in collaboration with other regional hospitals. We were able to quickly transition to televisits, adapting to sort of new information that is rapidly changing. As Dr. Thibodeau had mentioned, is that sometimes we get conflicting information about what's appropriate and what's not. Many times it takes some additional time to sort of help us sort through that data. Our current process, particularly with regard to York Hospital, represents best practice for our community hospital with some unique challenges. We've been very fortunate in order to partner with the state and Seacoast Labs to provide really rapid turnaround testing for COVID. As Dr. Thibodeau had mentioned, we actually do very well in the state as far as testing for the most part. I would tell you that we had our challenges as well back in March, April, and May about having those tests become readily available. Our screening procedures include reviewing questions with patients before they come in for their visits, as well as when they're here at the office, temperature checks and proper hand hygiene. We do limit visitors to reduce the risk to patients and family members unless there's been sort of extenuating circumstances. So for our hospice patients, end-of-life patients in care, we certainly make exceptions for those. For those with day surgery, and you know, we also in the practices, some of our patients that require either additional needs or assistance, or if they have cognitive issues and have difficulty with memory, being able to understand some of the instructions. We do use universal masking and hand sanitizing. We've really made a great effort to try and limit exposures in the waiting room and often directly room patients from the car to the exam room. We used to, I think that previously you used to go into many waiting rooms and there were a number of people congregating in there. I think that is certainly something of the past. Social distancing for waiting for checkout, and we're adjusting our visits to allow for proper cleaning. Our virtual check-in, we had recent upgrade of our system, so we expect sometime within the next month or so, piloting in certain practices, that you'll be able to check in from your car on the phone, and should be hopefully quite seamless. So those are some of the things to come. Why is it important to not delay your care? We certainly know that individuals at higher risk for complications after becoming infected include those with diabetes, obesity, heart and lung disease. It's a big push for us to reinforce the importance of, as Hillary mentioned, as a stressful parent, to make sure that you take those efforts to keep those conditions under control and in check. Prevention really remains our first priority. It's important to have an open line of communication with your primary care office to help guide you on any symptoms that you have, and appropriate testing that can be done. And I think that the other important fact is, don't ignore how you feel, and take appropriate precautions to protect yourself and others, because you may not think your symptoms have significant, that are significant, but they may have a huge impact on others that you're around. Success for your health. Certainly wear your mask and practice safe hand hygiene. I've had a number of patients come in and are very proactive about asking about immunizations and whether they're up to date. People who previously had declined immunizations previously have started to call for things like their pneumonia vaccine, their shingles vaccine, the importance of the influenza vaccine. And for those, we often get questions about Tdap for those parents or grandparents because of whooping cough. I think it's important for parents and even our older adults to be able to say no in situations if they feel uncomfortable. I've had a number of family members who, we live in a wonderful community setting near the beach, and there's typically an influx of families over the summer. There are a number of my patients who felt uncomfortable with that. I've had patients that have not wanted to put themselves at risk because it's very hard to control sort of who comes and goes. So I think it's important to say no. I think that certainly adequate sleep and regular physical activity, adults do very well with regard to regular routines, as Hillary or as Harriet had mentioned earlier. And I think it's important that this has led to some, social isolation. So remaining connected with family and friends, whether it be via phone, social media, FaceTime, to help reduce those feelings of isolations. I think that as we go through the community, and this is really my last slide, that as we prep for the fall, I think it's important for people in the community to understand that we'll have availability for drive-through testing for things like COVID, influenza, and strep. We're making a huge conscious effort for flu shot distribution for all our patients while accessing New York hospital system. So if you're on campus or you're in your primary care office, ask for your flu shot. It will take just a little bit longer, but it'll be important for us to get that to you. Respiratory illnesses will be directed to appropriate walk-in care and testing at certain sites. We are trying to keep the well and those that are sick in areas that we have better control. And the impact on our PPE, which is our protective equipment, is certainly, we still do not have unlimited supply, so we still have to prioritize that. The hospital website is important to help us maintain certainly the gating criteria and the current levels in our community. And we have a number of providers across our organization and experts who, as we've gone through this, we may not have the answers right away, but often we can communicate amongst our colleagues and get those answers for you. Or if we still don't have a strong recommendation, we can point you in the right direction, but there's still so much that is unknown. And I think my last point is that you should plan for both the expected and the unexpected. I don't have small children now, but I still have college-age kids. The challenges of going back to school, both for, elementary and middle and high school and colleges all have their challenges. Keep tabs on your kids. I still try to give them advice, even though they're of age where they can ignore me, but it's important that they really understand that this is a disease which can have a huge impact on our community. So with that, I will finish up and leave that open to questions. Thanks for allowing us to speak today.
This is Hillary. It looks like there's only one question in the Q&A, but we did receive a couple of questions prior to the webinar. And Dr. Thibodeau, I think these might go to you. What is the thought on sharing sports equipment? Could students at a grade level share things like dodgeballs?
Sure. I mean, I think there's a lot of factor that goes into sports, and equipment is just one of them. I think that there's no one thing that you can do to completely eliminate the risk. There's going to be multiple factors that go into decreasing your risk. So sharing equipment is probably I think the big thing is the distancing and keeping your 6 feet and keeping yourself masked when you can during sports activities. I can just tell you, I can't say specifically for dodgeballs, but for the data is showing that this is more of a respiratory virus type illness, and that really maintaining the 6 feet and masking is probably our priority, in addition to hand sanitizing and decreasing the risk of not just COVID, but other viral respiratory illnesses as we go into the fall and winter season. So I can't say for sure on the dodgeball per se, but I think it would have to depend on what other factors were going into that activity, and if you're able to kind of mitigate some of those other higher yield factors.
Thank you. We also had another question about, do you think it would be helpful if a sample of students, maybe 3 to 5 from each cohort and grade, get tested at regular intervals to act as sentinels, maybe once per week or month?
Is this for me as well?
It's for whoever on the team who wants to take it.
I mean, I can just give you a quick stab at it, that they are doing this with college age students. They're doing routine testing in the college situation, and I think if you're going to test people, you just want to make sure you have a plan of what you're going to do with that information. So if you're going to be testing the same folks or different folks, testing it's great. It's certainly, from a diagnostic standpoint, it can tell you if you have the disease or not. But yes, from a surveillance standpoint, it can help tell you, what's going on in your community. So I think if you want to implement that, it can help you gather information, but just have a plan with how you're going to act on that information.
Again, thank you all for attending today.
Thank you.
Thank you very much.